Frederick, welcome to Beirut.
Thank you very much, Amany.
How's your experience of Beirut so far?
Well, I love Beirut. First visit was now 12 years ago, 2010, and I don't know how many visits I had since then. So today we had a great day, great lunch, and I mean the weather is nice, people are friendly, so what else can you ask for?
Amazing, perfect. Now let's talk about Sweden and the women in Sweden and what they love. So basically when women go to your practice in Sweden, what is most what they ask for? What's like the beauty trend, or what's the main thing that most women in Sweden ask for in terms of beauty?
Yeah, so many people think that Sweden is people filled of blondes and Swedish people,
yes,
right?
Yes.
But you know what, it isn't. Sweden is a very friendly people which has created a mixture of the culture. So Swedish people are from all over the world.
So not all Swedish people look like you.
No, but we have friends from Middle East, from Asia, from Eastern Europe, from Western Europe, and I would say that there is not a Swedish archetype of one patient. So I think that Sweden actually reflects a lot of worldwide
the international
beauty.
Yes.
Yeah, it's very international, and then it depends who's coming to my clinic.
True.
So for example, I have a lot of Lebanese people.
Amazing.
Lebanese
What do they
patients.
ask for?
Yeah, what do you think?
BBLs maybe?
Yeah, of course. So what we see in, which is really nice, is that we move focus from one thing of the body or the face.
Yeah.
It's more of a holistic view. So
right.
from, you know, we've been in the same business for many years, Amany.
True.
Yeah, and somewhere it started out with a frown wrinkle, and we expanded to a holistic view of the face.
True.
The same thing has happened with the body. It's not only a pair of
It got
breasts.
the trend after the face. Because at the beginning it was more about the face, and then...
in a way, but it depends.
Yeah.
I know you're more into facial.
True.
I'm more into body maybe, even though I do a lot of facials. But from having focus on, for example, breast augmentation, so now you can see the holistic view. And looking at a holistic view of the body and the proportions of the body, then we comes to what you're talking about, the BBLs.
Yeah.
Because the BBL is not about getting a huge butt.
True.
It's getting a nice proportions.
Now they're asking for less, right? At the beginning, they asked for this like huge curvature with the butt and the really small. You did once a surgery, like when you did like the lady with the smallest waistline, I remember.
I mean, there's a lot of media attention to all extreme treatments,
True.
but I think that we have now maybe a little bit more balance in what we're looking for, and that the balance is more getting heard.
I see.
In a way, so I think that proportion is important, not extremes.
But didn't people ask for extremes in the beginning, and then they changed into like more softer curves?
Yeah, because
now?
in the beginning with all new treatments, it's really dedicated patients looking for that treatment.
True.
You understand what I mean? So, now as
people who just want to follow the trend no matter what it is.
And now as it becomes more common, it's more a part of the holistic thing.
But as you're saying, like we're having the same thing in Lebanon, like in Sweden, we've even had so many patients who went to like extreme BBLs, like very narrow waistline, very huge butt, and then like now they just want it removed and they want the softer
So with anything,
curves.
it's two things, right? So even if you do cheeks or lips on one of your patients, one thing is size and the other thing is shape.
True.
Right? So I might be different from some other doctors, but it's not my choice to choose a size for my patient. I don't decide what size you want, but my responsibility is to give you the shape.
So it depends how they see themselves, or how the patients, they want to see themselves.
There are limitations, of course, and I need to make individual judgments for each patient.
And to do a certain explanation and certain advice to what would suit them.
Yes, because some volume, if you exceed a volume, then you might not have a nice shape anymore.
True.
So then it's my responsibility to tell them.
True. So like, which procedures are you most passionate about doing?
I think in a way, many of the procedures we do, it changes a patient's life. And it doesn't have to be that specific procedure, like if you're asking me to do that procedure or that procedure, but the experience which we have. So actually, 2 days ago, one of my patients, she did a quite big mummy makeover, and after procedure we open up and we have a look, and she was crying of happiness. So that is a great moment for me, for my staff, and for the whole clinic, of course. And then you could have another situation. Just last week we had a young patient, only 19 years old. She had what we call mega mum, really big breasts, neck problems, everything. And she's been waiting for this procedure, and we really removed a lot of tissue. She was also almost crying by happiness after this. Two different indications. One patient, she had her children and the body was affected. She got back to what she was before. And then you have this young patient who finally got what she was dreaming about for a long time of her life. Smaller, firmer breasts and no neck pain anymore. So
basically what you're most passionate about is making your patients happy.
The patients.
Yes.
It's more important than the procedure. So,
yes, exactly. I think true. It's the most satisfying part of what we do.
The interaction with each and every patient, that is the number one thing.
Amazing. Let me think of what's next for me to ask you. I need to make the most use out of your presence here in Beirut.
As always, Lebanese people do.
Yeah. So, all right. So you're also an international speaker, and your name is in most of the international conferences, and you share your experience with a lot of doctors around the world. And now you're sharing it with us here, and we're very grateful for that. So, how do you feel this part of your life of being an international speaker and international trainer and interacting with doctors worldwide affect your practice in Sweden? Does it?
I think it definitely does, because I've been doing this for many years. First visit to Lebanon 12 years ago, and I think that when we share knowledge is one important thing. Then also doctors share knowledge back. So by sharing knowledge and
I love sharing knowledge.
But then you gain, and everybody, the whole society gains from this. The patients gains, and you get to know more. You also need to be humble about knowledge, because knowledge is not a fixed thing. Things change and it develops. So I think you need to be humble to your old views. We looked at something 5 years ago, 10 years ago, and today we look at it differently.
Exactly.
So except for me not being at my practice every day, which of course affects my practice.
True.
I think it makes us more dynamic, and I also bring it back to my colleagues and staff at my practice. So we have a continuous dialogue. I have a lot of doctors visiting me in small Sweden as well.
Amazing. Book me on your schedule for next year.
I will.
Now let's talk more about Brazilian butt lifts. So you're famous for this procedure. What is it that women look for in this procedure? What's mostly the conversation that goes on between you and the patients, their expectations, and what do you recommend for that?
Yeah, so basically it's about proportions, as we mentioned, and one secret area is of course a hip dip area, and the other one is a back projection. So we're comparing waist-hip ratio, of course, that is one different thing, but it's a lot about creating smooth and nice shapes. So basically we have 3 approaches. One is a Robin Hood surgery, which we call it, where we remove the fat and move the fat.
I didn't know it's called Robin Hood. All right, I like this.
Yeah, but it's a classical.
So you take from one place and you put in another.
Yeah, so remove the love handles and move it back down, and you will double the effect.
All right.
An option, if you don't have fat, is of course gluteal silicone implants, which gives you more back projection.
Alright.
And the third thing that we actually can do gluteal augmentation with is body filler. And that is a reason why I came to Beirut this time, to talk about body filler for gluteal area. So no matter which way you want to go for this, it really changes the shape for the body. And for body filler, we had it today talk for a lot of dermatologists, so it's not only for surgeons.
True. And so this is how do you choose? So if the lady didn't have so much fat, you would opt for either a lot of projection and then the silicone implant, or maybe the body fillers would be more softer contour.
So first of all, if a patient has fat, you will benefit from removing it in the total shape.
Nobody wants the fat.
So then the second thing is if the fat is already removed, or they want to have more, or they don't have fat from the beginning, then you go for the implant or for the body filler. And they are both good, but some patients, they want to have the implants, they want to have the bigger projection of everything, but that also means scars. It means the surgical procedure with some risks, which is higher than with the body filler. And
whereas with the body fillers, you can do it in the clinic, and there's no need for an actual surgery.
There's a big difference from body filler. You do a lot of filler for faces, Amany, right? And when you do a filler for the face, the goal is not to reach the end at one session. It's a progress journey, right? So you start somewhere, you take it step by step. As if you do surgery, you want to reach the
one-time thing.
Yeah, you want to reach the end result. So in that way, I mean, body filler, it's a quick, easy treatment. You don't have to stay overnight. You don't have to have general anesthesia. You need to be careful on how you sit for 2 weeks.
How?
No, you should not sit on the area where we injected. Right?
So you don't sit?
You can sit, but you sit on your legs or with a BBL pillow. Just to not.
There's how is that pillow made?
Have you never seen a BBL pillow?
No.
No, it's a special pillow to reduce pressure.
Yeah, so it handles the way.
You sit on your legs, so it raises it up. Yeah.
And you take the pillow with you wherever you go.
Yes, you do. And you use it for implants, for fat, or for body filler, anything. So body filler is more of a journey, where you can add more. We don't add.
I like journeys and soft, smooth progress.
How can you know where you want to get before you are there?
Amazing. And even there's also the psychological part of it, where you're accepting this change smoothly, because plenty who get implants, let's say breast implants, she sleeps having no breasts at all, and then she wakes up the next day and she has these breasts, and it takes her time to adapt and adjust to this immediate change in size.
True.
So with body fillers, basically they don't have this kind of issue with they have a soft transition, step by step, and they accept this change and they get acquainted more with it, right?
And then of course it's different indication. I have patients who
some people they
do first the fat, then they do the implant, and then they top it up with body filler.
That's having everything,
that's
basically.
Having everything.
Wow.
It's
Wow, perfect. And I would imagine that so many women would ask for, I want to have it all.
But then also, we can treat cellulites, hip dimples, and
the soft parts. The
soft parts. So,
all right.
So it's good, and it's all about creating that holistic shape for the patient.
Agreed. So that would be what women want, and basically nobody wants what women want. It's part of what women want.
Okay.
So what about men?
Yeah.
What do men ask for? What are the most procedures that they seek?
For me, I mean, men is, as you know, we are a little bit more immature in many ways, right?
All right.
I would say so. The knowledge and how we reach out to aesthetic medicine or aesthetic surgery whatsoever. So men are a little bit more immature.
Okay.
We can agree on that. So that means
they need more guidance.
They need more guidance, I would say. So if we look at body treatment, the number one treatment is not a BBL. Mm-hmm. It's not, but it is body enhancement. The most common for me is actually high definition liposuction.
True.
And what we do,
Men have these and they want to have
they want to have six pack.
True.
So instead of, we remove fat and we remove it in certain patterns to create that, but what we actually do is that we reuse that fat to enhance the muscles. So we can do intramuscular injection to create better six packs, as we do for many women. We create a better buttock or a Brazilian buttock, so we use it to create the six pack for the men.
I see. So for the women it's more from behind, and for the men it's from the front.
For the men it's more from the front, and from the behind it's more about just removing.
Yeah.
But we do a etching on the back as well to increase that visuality of the muscles.
All right. So like basically, so you use men's fat in order to make their muscles look more defined.
Yeah.
And so you take it away from one place and then inject
it's
it in
more
another.
taking away and then putting back.
Yeah, yeah, you just put it just a little bit.
And it's
back.
very important that that the men don't gain too much weight afterwards, because then they will be fat with six packs, and that looks strange.
Yeah, I would imagine. But there's also there's a technique where they use lasers to define the skin, like.
We do that, yes.
Yeah,
and
but
in addition to that, but you don't need a laser to that. You just need to be more superficial in your liposuction.
Yeah.
Because all the fat.
And you create the. But that would look very weird after that if they get more fat.
Yeah, they become
it would just
fat.
it will look asymmetrical and then
Yeah,
right?
it will not look natural at least.
At all. I'd agree. I'm gonna ask you one final question. How did you like the Lebanese food in Beirut?
Lebanese food is always good. I love it.
Right.
So, and I like that you have small pieces of different things. It's always fresh, I think. So yeah, I like Lebanese food.
So we'll and Lebanese people.
And Lebanese people, yes.
Perfect. We'll agree on that.